way that VCU pivoted to virtual as quick as they did and offered extensive resources to help students really enabled me to get all A's last semester, to continue doing this research, and to not feel like my physical health is threatened in the least.
We decided that we were going to do everything that we were able to do before. We just needed to figure out how to make that work.
One of my disabilities I have is rheumatoid arthritis. And because of that, I actually take immunosuppressant medications, which make me extremely high risk for complications due to COVID. I felt like they have really taken the steps necessary to make me feel safe and able to continue my academic pursuits.
I reached out to Spit for Science and I said, we'd love students to be able to continue to use the research data just remotely. And I was able to work with Spit for Science to get students access.
Not only was I learning how to do the fundamental basics of doing research, I was doing it with something I'm passionate about, with a community that I've been in as long as I can remember.
And we know from research that those types of experiences are of particular importance for students from underrepresented groups.
We had this set community every day where we could be safe in our home environments and still connect to other human beings. They really made us feel every day like they cared about not just what we were learning, not just what we were doing for their class, but that they cared about us as people.
I've been pastor of this church for 25 years, and I have not seen a kind of relationship with the medical community and with the African American faith community as we have right now.
And we may be the only program in the country that has weekly engagement, weekly interventions, weekly activity directly with our communities. Facts and Faith Friday is one effort. At least once a week, we are giving what is trustworthy and trusted information to not only our faith-based leaders, but those faith-based leaders in turn are giving the same information not just to their congregation, but to the communities at large that they serve.
And my group, just the ones that I notify, has grown to over 40, almost 50 names. He has expanded it even beyond that to include other segments of the medical community. We talked about not only COVID and how it impacted the churches, but those other health disparities that have existed for years in the African American community.
Between the two of us, me as a university representative, he as a faith-based leader, and Rudine Mercer Hayes as really the sort of glue that holds all this together, we've been able to really make a powerful partnership.
We're looking at now at ways in which the church can aid in receiving the actual vaccinations. We made informed decisions that I know in fact save lives. This intentionality is greater than it's ever been for the African American church and community. So I believe in VCU.
At the age of 30, I felt unstoppable, and I contracted COVID. I had no underlying conditions. When I walked into the hospital that day, I never in a million years imagined that I could have died and never been able to kiss my kids goodbye, give them a hug, say goodbye to my husband.
She experienced respiratory failure with a prolonged stay on mechanical ventilation, ultimately leading to her need for a very prolonged recovery and rehabilitation.
They just have changed my entire life, from my respiratory therapist to my nurses, to my doctors, all of them. I mean, I've had them call and check on me.
When you enter the hospital to fight this disease, you're not just entering the environment to do battle with the illness, you're also entering a period of isolation from your friends and family.
Not only did they physically keep me safe, but mentally, they kept me encouraged and motivated to not give up.
Since the beginning of the pandemic, VCU has been on the leading edge of clinical trials and internal clinical research projects as well in fighting this disease to continue to improve the care and the survival of these patients.
When I had bad days, they'd sit there and cry with me. But man, when I had those good days, they were there clapping with me and cheering me on.
It's been exhilarating, it's been exhausting. We've learned a tremendous amount that I think will benefit healthcare at every level for many, many decades to come.
Hello, I sure wish we could be together in person, but I'm really grateful for the opportunity to be talking about VCU's great successes this year, and I'm really enthusiastic to be talking about where we're going in the future. The year behind us has sure presented us with challenges like none of us had ever seen. I'm deeply appreciative that together, as one VCU, we are emerging stronger than ever. That's because of your enduring commitment to our mission. Unlike almost any other community I can think of, you showed how well a community can come together, unite, and take care of each other. Our mission is to serve students, patients, and our communities in the very best possible ways, leading every person toward their success. So, when I think about our mission, I ask myself two questions. One, how are we doing? And secondly, how can we do better? Thanks to the dedicated, passionate, and it's really not hyperbole to say this, heroic efforts of our faculty, healthcare team members, students, staff, alumni, donors, and so many others, VCU and VCU Health are turning this crisis into a moment to remember. So now we need to transform this moment into a movement. And our movement is among the most inspiring there is, creating transformational educational and healthcare opportunities for all people by improving access, affordability, and timely outcomes. VCU and VCU Health have long been at the vanguard of this effort, and the future, though not without challenge, is really, really promising. And you, every one of you, you're at the heart of this movement. As you saw in that video that we just played, there are many people who make this mission and the movement a reality. My mind is drawn powerfully to Audrey Robertson, who's been a member of our team at VCU Health for now 31 years. She runs our medical respiratory ICU, which treats our sickest COVID patients. I was really inspired rounding with her just a week ago. In December, Audrey was the very first person at VCU to receive the COVID vaccine. And back then when she received the COVID vaccine, she said, "We are here to support this community and we will not let them down." Yep, that's VCU. We will not let the people who need us down. What we do will reinvent and redefine the human experience for all human beings for generations to come. It's just who we are. Our movement is based on foundations of success that are the envy of so many around the country. Despite the COVID pandemic, our students graduated at the highest rate in our history. We expanded research, creativity, and innovation, setting institutional records for research funding, 8% higher than last year's record that we achieved. Our VCU health system continuously maintained access to life-saving care that we're known for. And we were among the first in the state to reactivate services to give access to all patients who need us. Case in point, we performed a record 459 life-saving organ transplants. And we also made a big impact on COVID. Some of the record research this year, led by faculty on both of our campuses and many of our departments, they focused on innovations in COVID treatment, inequities, and impact on the elderly, K-12 education, and so many other areas. We successfully completed our largest fundraising initiative, more than the previous 3 efforts combined, thanks due in part to the Children's Hospital Foundation, our partner in VCU's pediatric care and research. And one of our largest campaign contributors, Ken Wright, he has now fully endowed the Wright Center for Clinical and Translational Research at VCU with one of our largest gifts that we've ever had in the history of VCU. You know, translational research is at the heart of our work, and it's why the National Institutes of Health continues to fund the VCU Wright Center. Translational research is focused on quickly getting treatments to patients through innovations that can come from the entire range of disciplines at a university like this, with the breadth and depth of the talent that you see at VCU. It's why we need to focus our research and bring as much of our talent from all of our disciplines to the 4 areas that more than 90 faculty members help to identify as strategic research priorities. Our implementation plan will enable us to focus our finite investments in interdisciplinary research in biomedical areas, engineering, humanities, as well as social sciences and so many other areas. And this will bring to reality the 4 key initiatives that represent our values and our mission of improving the human condition and public health at large. Just as a reminder, these 4 areas are enriching the human experience, achieving a just and equitable society, optimizing health, and of course, supporting a sustainable ecosystem. You know, there really isn't a week that goes by anymore without VCU being recognized nationally for its research. Research by faculty on both campuses and across all of our disciplines, from medicine to the arts, engineering to education, and pharmacy to business, and those are just a few examples. A really inspiring example of research spanning disciplines is our Medicines for All Institute, where the College of Engineering, together with the School of Pharmacy and the Chemistry Department in Humanities and Sciences, is solving the nation's generic drug shortage problem, something that's really serious for all of us. We've worked together as one VCU for a safe, healthy, and successful spring and fall semesters in 2020. Today, the infection rate on our campus remains consistently below those of Richmond and the other communities across the state. You know, in many respects, our campuses have been among the safest places to live, learn, and of course work. In this difficult time, our faculty's and our staff's engagement with our students and our students' fortitude and resilience, that's what's led to higher than expected enrollment numbers in the summer and in the fall of 2020. And I'm so grateful, very grateful for the Federal CARES Act funding and the Commonwealth's critical funding support through this pandemic. Those funds, along with strategic cuts that were already put in place for this fiscal year, that's what's resulted in a stable financial situation at VCU. Unlike many colleges and universities, we'll avoid furloughs and layoffs during the COVID pandemic through the rest of this fiscal year. Beyond our focus on COVID, though, we've continued to address issues that have always mattered to every one of us. Never forget the value of higher education, especially its positive impact on social and economic equality. At VCU, 17% of our students move up 2 or more income quartiles after they graduate, among the highest of any university in the Mid-Atlantic. Every student can succeed here and will graduate into a world that needs them to be whoever they are. When it comes to success, there's room for everyone. Our pursuit of justice and equality, coupled together with our location in the heart of Richmond, it demands that we must acknowledge the lasting and harmful impact of racism on educational and health disparities. Issues that particularly affect African Americans, issues that are exacerbated and highlighted by the pandemic. I'm reminded of the tragic death of our own alum, Marcus David Peters, and my heart goes out to his family and his friends. We have to work to prevent these devastating tragedies. Events of the summer connected to the killings of George Floyd, Breonna Taylor, Ahmaud Arbery, Rayshard Brooks, and so many others, they've raised the social consciousness of our nation about the inequities and disparities that exist in America. This awareness has catalyzed critical discussions across our nation and within our university community. There's still so much that we've got to do because there's still so much that's just inequitable and wrong. The past informs the future, which is why the Board of Visitors approved the decommemoration of Confederate plaques and statues. This was not done to erase history because history can't be erased. The university acted to create on-campus space for important stories to emerge that will contribute to broader and more representative realities of VCU. You know, Black History Month gives us time to recognize all who have led the never-ending fight for equality, which is fundamentally right and at the core of our mission. And with the naming of the Fine Arts Building to honor former VCU Arts Dean Murray DePillars, we recognize the accomplishment of a great man who was dedicated to unifying and bringing together all of us here in Richmond. He brought diverse communities together to learn, to create, and to engage in needed conversations through the arts, culture, and of course, music. We are all delighted that the Fine Arts Building bears his name, and our work to commemorate the extraordinary achievements of African Americans continues well beyond this month. So, in the last few minutes, I've recapped a bit of our journey in the past year. Now I'd like to turn to the journey ahead of us and look beyond COVID-19. We're making headway, some of it jump-started by the pandemic, of course, and accelerating our innovation in teaching modalities and in spotlighting disparities in our traditional teaching models. We continue to make significant strides in graduating students. When I came to VCU, our 6-year graduation rate was 49%. This semester, it was higher than the national average at 69%. This is one of the greatest achievements at VCU, and it will only get better because of all of the great work that all of you have done to make this happen. Our first-year retention rate needs to be 90%, 84% for the second year, and 80% for the third year. We have about 5 to 10% to go in each category to meet these goals. That's doable, and we will do it. To get there, we've got to think differently about what curriculum is and what it means to our students. This begins by addressing barriers to retention and graduation, like in courses that students have high rates of D's, F's, and W's, and it's often disproportionately students of color. I'm particularly concerned about men, African American and Latino students who graduate at lower rates compared to the university's overall average graduation rate. So we've done something about it. We've launched the Men of Color Initiative, which has just started, and it's aimed toward enhancing educational and learning experiences for our male students of color and to foster a more supportive environment. For all of our students, we have to provide engaging experiences that teach what needs to be taught so that when students learn it, they can contextualize what we're teaching. They know why we're teaching what we're teaching. By addressing the needs of people who are most vulnerable, we lift and empower the lives of everyone. And we've taken that to a new level with something we call REAL, which stands for Relevant, Experiential, and Applied Learning, which, beginning in the fall of 2021, becomes a graduation requirement for all undergraduate students. We're achieving a vision, just one that I announced only a few years ago at the State of the University address, that every student will engage in at least one high-quality real-world learning experience, an experience that prepares them to be ahead so that they can lead in an increasingly complex and interconnected world. To achieve better student experiences and outcomes, we need to better support our faculty who have shown tremendous efforts, especially during the pandemic, towards student engagement and improving pedagogy. We'll look to improve and expand resources for faculty development in the near term and also in the long term. And we'll look to things like the Center for Teaching and Learning Excellence and online at VCU. We'll address barriers to interdisciplinary courses and research. The faculty wants it. Students, both undergraduate and graduate, want it. Postdoctoral fellows want it. And the world needs it. We've got to eliminate historical and unnecessary bureaucratic walls that prevent our faculty from moving forward with innovative teaching and research. I sincerely thank Provost Gail Hackett for her strong leadership and support in all of these areas. Gail retires at the end of this academic year, and we're fortunate that she has invested the pinnacle of her career with us, building a great team and, of course, really important institutional systems and services that will well serve students and all of us, really, for years to come. A search for a new provost has already attracted national attention with really strong candidates. We're also working to improve the healthcare experience here and everywhere. Take, for example, the Healthcare Innovation Consortium and DesignRx, part of the VCU Da Vinci Center for Innovation. This was something you might remember that I introduced at this occasion about a year ago. The HIC, as we call it, unites healthcare practitioners, entrepreneurs, and investors to bring healthcare innovations to reality. In its inaugural year, they already have 65 new projects. 65. Likewise, efforts led by Innovation Gateway and VCU Ventures have resulted in the publication of more than 165 patents, 42 products launched to market, and the creation of 55+ startups. And we've made tremendous progress in the quality of care that we provide to our patients in our hospitals and in our clinics because of our teams. And we've done this with the added pressures and stress of the pandemic. We've just been told that our medical center placed in the top decile of our peer group, ranking second out of 36 large, mostly academic medical centers that are caring for complex, high-acuity patients. This is according to a fiscal year 20 Anthem performance score for quality and safety. I'm very pleased to welcome our new Senior Vice President and CEO, Art Kellerman, to our team. This is something that he's going to do to lead us to new heights in patient care, patient experience, and student learning. And we're thoughtfully crafting new spaces that will enhance our ability to provide the very, very best care and access to all patients, and of course, for our learning environments for our students. We just cut the ribbon on our new engineering research building. It is stunning. VCU's inpatient children's hospital, Wonder Tower, is on schedule to open in the spring of 2023. And we expect to open the new Monroe Park campus STEM building about a year from now. Our adult outpatient pavilion is on schedule to be completed at the end of this year. This great new facility will provide easy access to VCU Massey Cancer Center's outpatient care, including our clinics, medical infusion, radiation oncology, for all of our patients and family members. It'll also co-locate services to ensure efficiency and collaboration between specialties, making it easier for our teams and our patients to navigate. This is a critical part of having the very best patient experience, which we're committed to at VCU. This will also help us to be designated a National Cancer Institute Comprehensive Cancer Center, which is the NCI's top designation, and it recognizes cancer centers with the highest level of interdisciplinary and transdisciplinary research collaborations and excellence in research, translation, and in training. Imagine how many more lives we can save, particularly those forgotten, when we enroll more dying patients in our clinical trials. As we complete these spaces for our people, most importantly, we are building a more holistic approach to focus on the overall health of each patient, more coordinated care, and easier access for every patient. Another example, we're also recognizing the importance of dental health as part of overall primary care, making it much more accessible to patients wherever they are. You know, it's really awe-inspiring to see what we, meaning all of you together, have achieved in fulfilling our mission under the most challenging of circumstances that anyone could have imagined. We've said before that at VCU we do what's difficult. This past year has sure proved that. So where do we go from here? As one of the nation's top premier urban public research universities, we have to foster complex change to promote transformative growth and success through access, impact, and responsibility. For so many of us, it's still just not right. The playing field is not level for everyone. The pandemic has brought to light so many social inequities across society and its systems that cannot be ignored or explained away. Inequities that we have to help address, inequities that are the core to our mission to help solve. We must direct our intellectual and creative prowess toward education, research, and clinical care that more intently addresses education and health equity issues in all of our communities. Take, for example, how COVID-19 has exposed the nation's urgent need to rebuild its public health infrastructure. In today's world, that involves more than healthcare workers. we understand that public health infrastructure also needs social workers, supply chain managers, crisis communicators, engineers, and so many others. VCU has core competencies in all of the public health disciplines, like epidemiology, infectious disease, biostatistics, environmental and occupational health, health policy, and many things more. We've also got much needed expertise in addiction, emergency preparedness, health disparities, and health communication, and of course, supply chain management. Imagine the power of bringing together this faculty expertise from across our campuses and departments, the passion of our undergraduates and professional students and our graduate students, and our community partners, all together to address major public health issues, to be able to prevent pandemics, to eliminate racial and economic disparities in health, to prepare future public health workforce that is diverse and ready to innovate for our collective health and our collective safety. I'm really excited because we're preparing to do something really big to lead in addressing our public health needs in a way that will help achieve greater equality among all people. So, stay tuned for more, a lot more, on this front, because in the near future, you'll hear more. VCU does difficult really well, and we'll be back together in the fall. We've started to vaccinate eligible faculty, staff, and students under the state's phased plan, and we anticipate that our community can be vaccinated by the start of the fall semester. Our community has proved that we're responsible together in following safety and health measures, showing respect and deep care for each other. Our fall return may not be exactly what it was like pre-COVID, but it'll be a lot closer to what we've known. And in many ways, I have to say, it'll be a lot better than previous normal because we've learned so much and we've experienced so much together. All of this has provided greater insight, compassion, and all of the things that we need to be doing for each other. And of course, it provides tremendous hope for everyone's future. Well, we all know that this is certainly a unique moment in time. It's clearly one filled with uncertainty and pain, but it's also one that allows us to recognize inequalities and the need to address them. We've got to learn from our mistakes and be better, and not just talk about a more equitable, healthy, and prosperous future, but we've got to lead a movement that makes that future a reality for all human beings. So, let's rededicate ourselves to this movement. Together, as one VCU, we're going to do all of these things. As Audrey Robertson said, we are here to support this community, and we will not let them down. That's VCU. We will not let down the people who need us the most. That's our commitment to advancing equality, to doing what's right. Let's be proud of what you've done to make VCU what it is today. Thank you for the innumerable ways that you have shaped this institution, and especially for the work that you do for the people that we have the honor of serving, the people who need us the most. Thank you.